this is for week 14. We are still delayed of 1 week day. So our lesson is nursing care of the family having difficulty conceiving a child. So we'll start discussing about infertility and the infertile couple. So infertility, as per definition, is the inability to conceive a child or sustain a pregnancy until birth. But um, again, this inability to conceive a child, okay, is because of so many reasons. So we'll have to study about that later. We also have here the infertile couple who are this infertile couple, one who has not become pregnant after at least 1 year of unprotected coitus, meaning you are together, the woman is having normal menstruation, and you are not using any family planning method. You are having sex, but still you fail to conceive as a couple. So that is what we call as your infertile couple. We also have here what we call as subfertility. When we say subfertility, it is a term used rather than infertility because it denotes that couple has a potential to conceive. Because they have found out that even if the doctor will pronounce that the couple is now infertile, there could still be the chance that uh, this couple could conceive. So this is what we call as your subfertility. So we call it as your subfertility. Okay. So again, we are giving them the doubt, or we give them the benefit of the doubt that still they could get pregnant. Okay. So it affects 8% to 12% of couples desiring to have children. So we have here what we call as primary subfertility, meaning talagang the woman have no previous conceptions or she didn't get pregnant. When we say secondary infertility, we say that the previous pregnancies occurred, however, the couple is not able to presently conceive. For example, um, she already have one baby but wala nang sumunod. Okay, so secondary subfertility or sterility is the inability to conceive due to known cause such as absence of the uterus. So anatomically, okay, this is how my obstetrician explained to me these things. For example, if it's anatomical defects, okay, so anatomically the woman has no uterus or have no uterus, so we call the woman sterile. Or again, syempre, there is no area for implantation, therefore we call it as your sterility. Okay. What are your nursing diagnosis? Okay, so the woman may have fear related to the possible outcome of subfertility study. So again, because there's still the possibility, they are still holding on to the possibility of getting pregnant or being able to conceive. Okay, they may still have fear of what the result could be if or what could be the reason of the subfertility, okay? Of kung pwede pa nilang magamot yun or hindi na. Okay? Number two, you have situational low self-esteem related to the apparent inability to conceive. Of course, it's every couple's dream to have a baby. So if, for example, the couple is not successful in that term, okay, there is what we call low self-esteem. Okay? They tend to compare themselves to other couple who are um who are again yung mga, ba, bilis nilang mabuntis. Okay, they will be having anxiety related to what the process of fertility testing will entail. So they wanted to subject themselves for testing, but then again the anxiety, the fear of the unknown is with them because they may not they may be thinking of what could be the problem or if the problem could still be reversed or if the problem could still be solved for them to be able to conceive later on. Another one is knowledge deficiency related to measures to promote fertility. So they might lack, lack information about how to promote fertility of what are the possible options that they could have to, okay, for them to be able to conceive. Another one is grief related to failure to conceive or sustain pregnancy. Again, they will be having grieving, okay? Why they will be grieving? Because every time that they lost the pregnancy, okay, so might be thinking that pregnancy is not for them. Sometimes in the Philippines, they would just think that baka pwedeng isipin nila ano na to na ano sila ng mga culture, yung sinasabi natin na inilokano manggagamot, okay? Or yung mga tao na parang ang tawag doon. I could not remember. Basta, okay? So, they might think that it could be because of culture, okay? Powerlessness related to repeated unsuccessful attempts at achieving a conception. For example, they might have in vitro fertilization, your gamete intrafallopian transfer, but still they are not able to get pregnant. Then they might be thinking that they are not, or they no longer have the power, okay, to conceive. And again, this could add to the problem of the couple. Hopelessness related to perception of no viable alternatives to usual conception. So hopelessness related to perception of no viable alternatives to usual conception. So sometimes they might think that it's really hopeless and there is no possible solution to the current problem of subfertility. Next, we have here the infertile couple. So who are the infertile couple? Again, it is very difficult for the couple to accept the fact that they are infertile. Who are they? They are the couple who are having coitus 4 times a week. Okay. But again, this one, if you're having coitus 4 times a week, it should possibly lead to pregnancy of about 75% within 6 months and 90% in 12 months. And again, less frequent coitus can make the wait longer. Kasi we have to take note that the woman here, okay, is ovulating once a month and the egg lives for 1 to 2 days, and then the man, okay, or have a sperm cell that lives 3 days, for 3 days, maximum of 5 days, and then of course less frequent coitus could might not be on time during the ovulation of the woman, making a lesser frequency, making the long wait, or making the wait longer. Okay, coitus every day could lead to lower sperm count, so that's why OB-gynecologist would advise the couple to have schedule. Okay, so that we could be assured of the number of sperm cells that could go inside the vagina. But then again, we are not after the number of sperm cell, but we are after the sperm motility. Even if, for example, we meet the normal number of sperm per coitus or per insemination is 400 million, okay? And 200 million will be able to enter the vagina, and 25% of the 200 million could be abnormal. But then again, we are not after we are not after sperm adequacy. No matter how many the sperm is, they have to be motile, because in the board exam we are after sperm motility, the ability of the sperm to run inside talagang run, to go inside the vagina until the fallopian tubes, and of course for fertilization purposes. And more than 30 years old women have less chances because of the number of eggs that might be present in the ovary. Because as we grow older, okay, okay, so pwedeng nagkakaroon tayo ng lesser chances of getting pregnant. Next is we have here male subfertility factors, disturbance in spermatogenesis, okay, or the egg formation, or we have inadequate FSH and LH production, or pwedeng there is an obstruction of the seminiferous tubules, the vessel that prevents sperm motility. So you have to find it out if what is causing the subfertility for us to be able to correct it at the earliest time. So as for us to decrease the possibility of anxiety and fear to both the couples. Okay, development of autoimmunity, there could be problems or ejaculation problems, or chronic or excessive exposure to X-rays or radioactive substances, general ill health or poor diet and stress. Again, this could be possible things that could cause the inability of the couple to get pregnant. Again, it's not the failure of the woman, but it's the failure of the couple, because it might be that the woman or the man is the problem, not only the woman. Okay, so low sperm count, okay, normal is 46 million per milliliter of seminal fluid, or per insemination, it should be at least 400 million. Okay. Next is we have here, so this is the anatomy. Okay. So how about radiation exposure? What would it do to your body? So this clear picture would tell you that excessive exposure to radiation could really affect your health as a human being in general, but it could be a great factor. It could be the sole factor of infertility or subfertility for men. So we have to advise them, okay, if for example these are happening, or they have a job related to radiation exposure. Yung mga radpex natin din minsan, okay? And even nurses and doctors are exposed to this one, and even engineers, okay? Or kung ano pa, basta importante yung mga na-expose yan. So we have here female subfertility factors. They have here inadequate FSH and LH production, that there could be a problem with the hormone production or anovulation. Actually, anovulation or the inability of the woman to ovulate is one of the most outstanding cause of subfertility, because if you are not ovulating, you don't have the egg. Even if you will have millions of sperm cells up there, okay, you will not be able to what? You will not be able to um to conceive as a couple. Problems of ova transporting or transport through the fallopian tubes to the uterus. So here, if there are no anatomical problems of the woman, and then you have uterine factors, like for example, you'll have your myoma, you will have your endometriosis. Again, what is endometriosis? Endometriosis is the proliferation of the endometrium to the other parts of the body, such as in your intestines, ligaments, and ovaries, or you'll have your pelvic adhesions. Okay, when you say adhesion, na nagdikit sila, or mga abnormalities, mga tumors na nandyan. Okay, so those are uterine factors, and you may have cervical and vaginal factors, anatomically wrong, or meron tayong mga tumubo dyan. Okay, for nutrition, increased body weight, and lack of exercise could also be a factor for female subfertility. Anovulation, again, ang sabi natin kanina, we mentioned it that it is the most common cause of female subfertility because of the lack of egg to be fertilized by the sperm cell. It could be caused by Turner syndrome or hypogonadism or limited ovarian tissue to produce ova. So if you are not menstruating every month, meaning there could be a problem in this, okay? So you have to check your obstetrician, okay? Or you have to be checked by your obstetrician, I should say, due to hormonal imbalances such as hypothyroidism or hyperprolactinemia. So it is thought that if the woman is not really having a menstruation of every month, the woman might not be ovulating that often. So ibig sabihin, there could be some problems of hormones, okay? Nutrition, body weight, and exercise could affect blood glucose, insulin balance. When it is too high, it interferes with the production of FSH and LH. That could be ovulation failure. So dito natin makikita that when your blood glucose is too high, or if you have diabetes, okay, so it could be leading to what? It interferes with FSH and LH production, and this could turn into an ovulation. So again, women who are obese have lesser chances of getting pregnant because of the very high blood glucose that affects the production of FSH and LH that would further affect the ovulation, or would lead to an ovulation. And an ovulation could lead to what? To subfertility. Another one is vitamin D may also be instrumental in maintaining pituitary hormone levels. So you have to be exposed to the sun. Okay? You have to be exposed to the sun. So nakikita niyo yung mga minsan yung mga babae na nasa office lang, they are not exposed to the sun. They have to they have, or they may be failing in getting pregnant. Okay? So another one we have here, your due to PCOS, okay, yung mga polycystic ovarian syndrome na pinakauso ngayon. Most of the women that we have right now, they have PCOS. So ovaries produce excess testosterone, thus lowering FSH and LH levels that could cause unpredictable irregular menses. So if the woman is having unpredictable and irregular menses, and if the woman is having PCOS, this could also contribute to an ovulation. Okay, this could also contribute to an ovulation. Okay, next tayo. So we could have we have problems here. Here are the pictures of an ovulation. It's the inability of the Graafian follicle to release the mature ovum inside the uterus. Or you have here adhesions or uterine factors such as your tumors and cervical factor. Again, cervical cancer, the presence of HPV, okay, could be a factor in, or even pelvic inflammatory disease could be a factor in subfertility. Okay. So our goal for 2020, that was again 4 years ago, reduce the proportion of women having these problems. Fertility assessment, how would you assess your patient? You have to be very particular of the general health, okay? So what are the comorbid conditions? What are the health conditions that might contribute to the a presence of subfertility, okay, nutrition, the diet of the couples, again, the things na, yung mga kinakain nila, yung mga food nila, alcohol and drug or tobacco use, how long it was, or are they still having, or drinking alcohol, or using drugs, or using tobacco, congenital problems in the reproductive tract, okay, your sexually transmitted diseases or sexually transmitted infections, or genital tract surgery that could lead to the possibility of subfertility. So these are again anatomical problems which which could be considered as contributory factors to subfertility. Again, another one is current illnesses. So what are the current illnesses? Okay. This time during the consultation, okay, ano yung mga current illnesses nila? Contraceptive history and pregnancies in previous relationships. Ayan, so you have to count the gravida, okay, and the parity. You have to take note of the contraceptive history, what were the family planning methods utilized by the woman, okay? Ano yung mga pinaggagawa niya? Okay, meron siyang mga abortions, for example, ano yung ginawa niya to abort the baby. That could again be a contributory factor or predisposing factor to subfertility. Occupational lifestyle and hazards, okay? So this one, again, you have to note then ano yung work niya. So you're able to know if, for example, they may be exposed repeatedly to radiation. Fertility assessment, okay, the health history, okay. So you have to know the health history of the male partner, again, radiation to the testis, okay, you are a driver, sometimes yung mga driver talaga, no? If they had cancer treatments or occupational exposure or diagnostic x-rays, okay, if they are technicians, if they are, ano to, mga IWs natin, sexual practices, frequency of coitus, masturbation, coital positions, failure to ejaculate, or sometimes yung frequency of coitus kasi syempre, for example, lagi ka naman nakikipag-sex and we are after, again, not only we know that the motility of the sperm is the number one, ano na to, is one of the number one criteria. But then again, the adequacy of the sperm during sex could also affect the possibility of conceiving a child. So the frequency of coitus could lessen the number of sperms as that's contributory factor to subfertility. Okay, I'm sorry for that. We have here masturbation. So they masturbate every day. So what will you expect? Talagang walang matitira dyan. Okay? And then coital positions, okay, and failure to ejaculate. And sometimes men who have erectile dysfunction could be a problem. How about the female partner? Past pregnancy. So you have to know if she had abortions, miscarriages, okay, or abortion. So we will be talking about the spontaneous abortion, your therapeutic abortion or your induced abortion in that. The menstrual history, you have to know if dinadatnan siya every month. Okay, you have to know pag dinadatnan siya every month. Pag hindi, so we have to be very careful with that. Current or past reproductive tract problems, if anatomically she has a problem with the reproductive tract, radiation to the pelvis, okay, the cancer treatment, occupational exposure, and diagnostics x-rays. Again, if for example, she had treatments, okay, so those could be, again, predisposing factors to subfertility. Use of douches or intravaginal medication or sprays. So you have to be very careful with the use of vaginal sprays when you're having cunnilingus or sex, okay? So it might contribute to the smell of the vagina, but then again, it could be a contributory factor to fertility. You have to be very careful, okay? Mas mainam na mabaho yan kesa sa ano yan, kesa sa hindi ka naman magkaanak. So you stop from using anything, okay? Detection of ovulation through symptomatology or female circumcision. Mom, what is all about the female circumcision? Because in other parts of the world, they really have the female circumcision, okay? They would not allow the woman to get pregnant. So ano pa, male partner, you have to assess the secondary sexual characteristic as the female partner. If they have genital abnormalities, breast and thyroid examination for the female, particularly as a hormone production of FSH and LH, that might affect the ovulation. So you have to note on that. Okay. Secondary sexual characteristic, kailangan talaga na form yan. If it's delayed, okay, pag hindi talaga maganda yung postura, then there could be a problem with the hormones. Okay. What else? Is there a sperm good quality? So you have to know with semen analysis if the sperm is good of quality, is of good quality, or the number is adequate. Okay, if for example for ova, okay, you have to have testing also, ovulation monitoring. You have to take note of the signs of ovulation such as Mittelsmers, your spin Barkay, your increased basal body temperature, and your increased luteinizing hormones. So you have to take note of that. Can sperm and ovum meet in the receptive environment? So you have to know if the fallopian tube is patent or there is no adhesion or tumors or fibroids up there. Fertility testing, you have to know, for semen analysis, they have to know the number of sperm, the appearance of the sperm, the ability of the sperm to go inside the vagina. So after insemination, we have discussed before that it should be 90 seconds and the sperm could reach the entrance of the uterus in the eastmost part, particularly of the uterus. And then in 5 minutes, it should reach the fallopian tubes, particularly the ampulla. Okay, and sperm penetration is the sperm able to produce hyaluronidase and your acrosin for it to dissolve corona radiata and zona pellucida because the sperm needs to undergo capacitation, di ba? Capacitation are the efforts taken by the sperm to penetrate the zona pellucida and the corona radiata of the ovum, wherein the sperm produces two hormones, your hormones, enzymes, I should say, your hyaluronidase, which will in turn dissolve the corona radiata and your acrosin, which will in turn dissolve the zona pellucida of the ovum. So that is capacitation. We talk about sperm penetration in that one. Fertility testing, ovulation monitoring, measurement of women's serum. Okay. Okay, wait lang guys. Okay. So ovulation monitoring, measurement of women's serum progesterone level during luteal phase of menstrual cycle. So again, they are monitoring the number of or the number of luteinizing hormone or the quantity of the luteinizing hormone of it's even elevated. Okay. Recording of basal body temperature. Again, the basal body temperature is increased during ovulation. And then measurement of urine LH upsurge for us to be able to know if the LH is high. Again, if the luteinizing hormone is high, definitely the woman is ovulating. So this could be the basal body temperature. Again, the basal body temperature is increased during ovulation. But a day before ovulation, there is a slight drop in your basal body temperature. And that is a common board exam question. Another one is fertility testing, tubal transport or tubal patency. So they will be doing the sonohysterosalpingogram with contrast, and they will have to do your hysterosalpingogram with no contrast or your transvaginal hydrolaparoscopy, injecting of 200 ml of saline solution in the vagina. So we'll have to see the picture. This is your HSG. Okay, so makikita nila why are they doing this with this one? Kasi gusto nilang makita if there are obstructions, adhesions, or problems of the reproductive organs anatomically. Okay. Another is, ayan. You'll have your transvaginal hydrolaparoscopy wherein they will be using normal saline solution for them to be able to look for possible abnormalities contributing to the subfertility of the couple or the woman. This one is contrast medium. Again, the presence of the contrast medium will give you a more definitive anatomy, okay? Para mas makita natin yung problema if there is or if there are. Right. Fertility testing, another one is you have your uterine concerns like hysteroscopy. They will visualize the uterus or uterine endometrial biopsy. They will have to see the endometrium if there's a problem with the endometrium or laparoscopy. Right. And explains of fertility. So what will you do? You have to offer active support. You have to help the couples find alternative solutions such as keep trying to conceive using assisted reproduction, your in vitro fertilization, your gamit intrafallopian transfer, or choosing to adopt if, for example, talagang naghihintay sila, or agreeing to child-free life. Again, it was never the choice of the healthcare provider, but again, it's the ability of the couple to accept the reality of subfertility, of having subfertility. Okay, so there are three types of women, okay? So the other one is I wish, the third one would be a girl, yun yung gusto mabuntis. Pangalawa, my only child, my world. So ibig sabihin they would not want another child. Or I don't want to have children, I am happy this way. So there are people, again, who choose to be alone or who choose to have a child-free life. So we have here the child-free life when having it all not means not having children. So they would just again, it's a decision of the couple if they want to enjoy life without children. And some just like having dogs, okay? Talagang nagkakaroon lang sila ng dogs para maging masaya sila, and they might not need, again, they might not need to have a child. So it's the choice. Examples of nursing diagnosis, knowledge deficit related to fertility testing. So you have to help the couple understand the process. Pag nagkakaroon sila ng grieving, kailangan nilang ma-resolve yung grieving process. Okay, again, your quality and safety education for nurses. it has to be patient centered. Again, you have to take a note of that every patient is unique. The need of the bed one and bed two and bed three are different. So they may have the same situation. They may be women of the same age, but then again, you have to to have an individualized care, meaning you have to focus on the need of the patient. Teamwork and collaboration would mean you have to refer if it's not your responsibility, it's not within the scope of responsibility of the nurse, then you have to have teamwork and collaboration for the couples to be for you to be able to help the couples to undergo the process successfully. Evidence-based practice, of course, what could be the importance of evidence-based practice in this? So we have to take note of the new procedures that could help the couple to get pregnant, testing or tests for us to be able to know what could be causing the subfertility, for us to be able to help them. Quality improvement in every way, and safety and informatics. So these are your QSEN. Another one is if the nursing diagnosis knowledge deficit, again, it's your responsibility to explain to them what are the importance of the diagnostic procedures. They might not know the importance of having this diagnostic procedures, but you have to, with you explaining to them, they might understand that and they might subject themselves for this. Anticipatory grieving related to failure to conceive or sustain a pregnancy. So you have to explore the importance and meaning placed on having children with a couple. Kailangan nung maintindihan why are they dying to have a child. Bakit gustong-gusto nila, why they are trying every way, bakit gusto nilang magkaanak. For you to be able to understand why sumusugal sila in every way. Explore with the couple their openness to alternatives to childbirth. So you have to, again, you have to ask them, you have to let them verbalize if they're open to such alternatives or not. Okay, so these are questions, so you have to answer it in your own. Okay, so this is question number 1. Screenshot, the answer is letter A. Okay, so it's the LH, that's the number 1. Number 2, women is using basal body temperature. Okay. To graph to monitor fertile period, she calls report that she did not see any temperature change during the past monthly cycle. So to which does the nurse attribute this? So saan? Failure to ovulate. So the failure to ovulate. And number 3, in counseling a couple who have experienced infertility for 14 months, which of the following true statement does the nurse base the initial information given to them? Letter A, transrectal and scrotal ultrasound testing is routinely performed in the male. Or B, semen analysis is usually not performed until the tests are in the female partner are negative. Or C, testing for tubal patency is performed during the same time period as ovulation monitoring is being done. Or D, fertility testing usually begins with ovulation monitoring in the women. So your answer is letter D. Okay, so this could be your assignment. You have to read on assisted reproductive techniques. Okay, thank you and goodbye.